after which he obtained a fellowship in nephropathology at the Amsterdam Medical Center in Netherlands. He is a member of the West Africa College of Physicians and also a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Laboratory Medicine. He is a consultant nephropathologist at the Obafemi Awolowo University Teaching Hospital in Ilefe, and a fellow of the International Society of Nephrology. He's always interested in the development of junior doctors, and is here this evening to talk to us on the theme topic of tonight's webinar. Sir, I would like to unmute your mic to take your section, sir. Thank you, sir.
Okay, thank you so very much, Heraldi, for inviting me for this webinar series. Particularly, I'd like to start by thanking Dr. Anoforo, who has been a friend and a wonderful colleague in the hospital, and for all the executives of the Heraldi who we have always been together in this hospital, and we've always had one or two reasons to interact, both at professional level and at some other levels. So I really want to thank you for inviting me. And to also Dr. Moyola, it's a privilege to be on the same table with you this evening to talk about opportunities and prospects in laboratory medicine. I hope you all can hear me.
Yes, sir, we can hear you very clear, sir.
All right, thank you. And you all can see my slides, I think.
Yes, sir, we can see the slide now.
All right, thank you so very much.
Yes, sir.
So within the little time I have, which I think should be enough to touch on the important areas of the topic I've been given, we'll be talking briefly on career prospects and other opportunities in laboratory medicine. I'll be using this outline to just make it succinct and to highlight the important point of discourse. We're going to be looking at what laboratory medicine is. We'll talk about the branches of laboratory medicine. Then we go on to talk about the career opportunities and prospects that there are in lab medicine. Lab medicine, like some people would like to call it in some other clients, or in our own client, we prefer to call it pathology. You know, it's an important aspect of medicine. In fact, currently, people now refer to it as a clinical aspect of medicine, unlike what we still refer to it in our own setting as what do you call it? The laboratory aspect of medicine. But whatever you decide to call it, there's no debating the fact that it's an important part of medicine, and it make attempts to measure both quantitatively and qualitatively any substance in body fluid or in body tissue for either medical or research purposes. And the parameters that are generated from this end are, translated to actionable information, which are used for improving the medical condition of a person or an entire population. And this laboratory medicine has many areas, depending on what your interests may be. You may be interested in the part of laboratory medicine that measures, that looks at tissue. I mean, you tend to look at tissue by processing them and looking at them under the microscope. There are different types of microscope that we use, like many of us may already have known. And this area of medicine, we call it histopathology. Some may decide to call it anatomic pathology, but in our own hospital, we call it morbid anatomy and forensic medicine. Another important aspect is microbiology. There's clinical chemistry, otherwise known as chemical pathology, and there is hematology. And some of that center, they will say hematology and blood transfusion, but whatever you're talking about, you are talking about the blood, basically. And these are the four major areas of pathology that we have in Nigeria. There are many more aspects, which I will also try to touch on outside of these climbs. But as far as our own setting is concerned, these are the 4 major areas. And of course, we know that before you can decide to go into any aspect of these areas of pathology, of course, you must have your basic MBBS or MBCHB, as you may decide to call it. And after that, of course, you have to write the general primary exam in pathology, and following which you want to hone down on any of these aspects. Well, as far as this is concerned, it's so important for anybody who may wants to pick an interest in the area of pathology to have all this information. But beyond that, even our clinician friends who, for whatever reasons, have gone to other aspects of medicine also need some information in this area, because this is a time when our clinician colleagues sometimes wonder what we do in the lab. Sometimes people wonder what we do there. The way they look at their colleagues in pathology, they look at them as if these are the ones who possibly could not cope in clinical medicine, and they have come to pathology to come and hide their ignorance. And I think there is a need for all of us to have some basic information about what we do in pathology, because going forward, it's really going to help our practice, both as individuals and even at association level. Now, what are the career opportunities in each of these branches of pathology? Because many a times, because people don't know the career prospects that are in the field of pathology, they sometimes just narrow it down to, area of medicine where people just examine the dead, or areas of medicine where people just decide to play with body fluids like urine, sputum, and the rest of it. But if people have enough information as to the possible prospects and opportunities that there are in histopathology, in pathology generally, maybe it may stimulate in their interest in wanting to come to this aspect of medicine. Now, the first one I would like to talk about is forensic pathology. Forensic pathology is a specialized area of histopathology that tends to examine the dead, not just the dead, even the living sometimes, that examine the body tissue and sometimes the entire body in order to be able to determine the cause of insult or the cause of death, as the case may be. And also for identification of bodies following maybe a big inferno or following a very massive accident, like it happened during the Dana air crash. I hope many of us can still remember. During the Dana air crash, many people died, and it was even difficult to be able to identify their persons. So it was the forensic experts who were able to, go to the scene and use their tools to be able to identify these persons. And this, in a way, helps to bring a relief to the families that are of concern. So this area of pathology is an area of pathology that individuals may venture into. And as we speak in Nigeria today, there are very few forensic pathologists in Nigeria. And, this is an area that from time to time, you always need more people. Morbid anatomy is different from forensic pathology. In fact, the way it is designed is that you would have done morbid anatomy 4 years, that's general morbid anatomy, then you now go for a specialized training in forensic pathology. In the UK, for instance, some may be offered the opportunity to do forensic pathology even right from the beginning. They do their general morbid anatomy, maybe in their second or third year, they now veer off into forensic pathology, where they will acquire specialized training in that field. And I must tell you, this is a very lucrative aspect of pathology. Another aspect is cytopathology, where they just look at cells in the body. They look at fine needle aspiration cytology and all that. And this is a very big area of pathology with very few people in this field. even in Nigeria, though we do everything together in morbid anatomy, we look at cytopathology, we do forensic pathology on one hand, it's because individuals have not been able to, take all these areas and specialize in them. And as I speak to you, Nigeria is still waiting for individuals who will pick up gauntlet in these areas and run with it. Now, another important area is molecular pathology. Everything we are doing now, we are trying to narrow it down to the molecular level. Molecular pathology is an evolving aspect, more so in our own settings, where we are not just looking at slides, where we are not just looking at, we are not just counting the blood cells and all that. But at the molecular level, we're trying to see what exactly is going on. And I think hematology is doing a lot of that. I will give Dr. Moyola the grace to handle that when it gets to his own turn. They do a lot of molecular profiling in their department, which in many ways is helping to manage patients. Now, another aspect of histopathology is neuropathology. As far as Nigeria is concerned today, Nigeria had 2 neuropathologists all over Nigeria. But sadly, no, one of them is dead. The other one is here with us in Ife, and I think he may retire in the next 5 or 6 years. Now, the thing is, with all the brain surgeries we are doing in Nigeria, if you don't get someone to specialize in this area and to begin to look at those things, we may as well be in darkness, meaning that it will just be like one is groping in darkness. You don't even know what you are dealing with. And there are many opportunities in these areas. Yeah, uropathology is another aspect. Nephropathology, is another aspect which has to do with, pathologies of the kidneys and all that. And soft tissue pathology. And lastly, the oral maxillofacial pathology. This is another rare area. As we speak now, OAUTHC does not have OMF pathologists. I stand to be corrected by our colleagues from dentistry, because the oral pathologists they had, all of them left. All of them left at one, in fact, one after the other, they just left the country. The only one that could have stayed died, and they only have one visiting professor of oral pathology now. And that one probably comes once in 2 weeks. And if you go to that department now, you see a lot of pile-up cases, waiting to be attended. So this is an area that I think these are opportunities that we can pick up. And life is all about finding the need and meeting that need. That's what gives you relevance in life. You need to be able to find a need, then you meet the need. So many of these areas are still uncharted area in Nigeria. As far as hematology is concerned, I will just touch on a few areas here. Dr. Moyola will dwell more on that. As far as hematology is concerned, we have an area called hemato-oncology, as aspect of hematology that deals with oncology majorly, and we are very proud to have Professor Dorosimi and Dr. Moyola as our hemato-oncologists in the hospital. They deal with cancer generally and all that. There's also immunology, there's transfusion medicine, there is histocompatibility and immunogenetics. So these are areas that have not really been charted in our environment. Though we have our hematologists doing all that, but we still need specialists in that area who will help us better. Microbiology, Dr. Anuforo is here. Will bear me witness that bacteriology is a field on its own. Virology is another word. Parasitology is there. Mycology, is another one. Molecular biology, these days an era, nobody just does sensitivity and what do you call it, culture and stop there again. They now look at the molecular properties of all those organisms, which help in better management of the infections that they cause. Chemical pathology, there's the routine chemical pathologies where you are just doing all sorts, you are looking at sodium, potassium, you are doing, but now there's also toxicology. There are individuals who just specialize majorly on toxicology. And these are people that help even forensic experts to be able to resolve some difficult cases at times. There are many more areas. The prospect, I'd like to talk about the prospect because sometimes for those of us who are in Nigeria, some people may feel so unlucky or they may feel frustrated. What am I doing in Nigeria? After all, some other persons have gone to the UK or some are planning to go, some are in the US. But believe you me, wherever you go, if you are not aware of the prospects that are in your field, you just see others, flying and you'll be wondering what is going on. Even as far as Nigeria is concerned, like I've told you, there are many areas of pathology that are still uncharted, and we are waiting for individuals to take interest in these areas. For instance, specialty fellowships. You won't just do, it's like doing MBCHB, and when you finish, you just go and establish one roadside hospital and you start doing all sorts of surgeries. You may have been doing that for years and achieve proficiency in doing some surgeries, but if you are someone who is actually futuristic and someone who really wants to do things at the highest level, you won't be happy with yourself without specializing in an area. So the same thing applies to doing residency in any area of pathology, and when you finish, you just start practicing like that without having to cone down on a particular area. You should be known for something that out of all these, this is what that if every other person should find difficult, I should be able to provide solution to, because pathology on its own is very wide. Microbiology is very wide. You can't be the bacteriologist, the virologist, the mycologist. It's like being the master of all, being the jack of all trade and masters of none. So there's a need for you to pick an area of specialization. And this you can do by applying for fellowships. In other clients, like in the US, there's no how you can practice as a specialist without having done fellowship. Though after finishing your residency, you can go and be practicing at one corner, but they call you a general pathologist. But the fellows, the people they call fellows, are people that after their own general pathology training, they still go ahead to do maybe 1 or 2 years post-residency fellowship in their area of interest. And there are many of these specialty areas in Nigeria. We have started some already. Maybe during question and answer, we can interact on that so that I won't take much of our time. Then you can also go for master's degree and PhD in laboratory medicine. Interestingly, many of them are actually free, scholarship in the UK, in the US, in Australia, all you have to do is just go online and search for many of these things, searching for master's degree, PhD in laboratory medicine. There are many of them abound, PhD in cancer biology. Even without even finishing your residency, you can be admitted straight up for PhD in cancer biology in the United States. So there are many opportunities like that. You can check the website of University of Bristol, for instance. They offer such a program. University of Wisconsin, they're also doing that. But you need to apply on time, and of course, you must have some experience in the lab, to say that you actually have an idea of what we're doing in the lab before they pick you up for such a program. Then you may also want to set up your own labs after you finish your program, for those who have the financial wherewithal, to do that. You set up your own lab, and there are tissues that will be coming to you, Many of the hospitals in Nigeria today, the turnaround time of our labs, government-owned lab, is so terrible that if you see any serious-minded personal individual who wants to establish a private lab, they make a lot of money. I can see many of these labs doing well in Lagos. And you can also access grants, when you access grants to do projects, you access grants, to do research and all that, It's a way of announcing yourself to the entire world, not just practicing in one corner where people may not even know what you're trying to do. Another one is, you need to participate in the conduction of research. With all due respect, I think many of the things we are getting wrong these days in the residency training program is that we are fixated on service. The research aspect is actually not being, it's not really being attended to, because ideally, before you finish your residency program, you should have like 3 or 4 papers. 3 or 4 papers, because that's going to give you some lifts eventually when you want to venture into academics or you want to apply for anything, after your program, So you need to begin to participate in research now. Join people who are doing research, I mean, if only to help them collect data, help them analyze, just see what they are trying to do, so that eventually, when you also finish, you will know how to go around conducting research and all that. Like I said, there are many scholarships, travel bursaries and awards, to attend international conferences. Because ideally, again, before you finish your residency program, it is advisable that you should have gone for at least one international conference. And it's at this level that you understand what's actually going on in the world of science. It's at this level that you know the opportunities that there are in the world of laboratory medicine. Because if you don't go out there and see what people are doing, you may feel like the world begins and ends, and it can be frustrating to be caught in that way. Another one is try to apply for membership of international professional organization. For those of us in pathology, histopathology, there are many of them, like British Department of what do you call it, International Academy of Pathology, that's BDIAP, EOTIC is there, even HAGO is here with us in the hospital. If you're a member of HAGO, there are many opportunities you'll be able to access. If you're a member of BDIAP, there are many opportunities you'll be able to access. International Society of Nephrology. I was lucky to have joined International Society of Nephrology, I think in my first year of senior residency. And before I finished, they gave me a grant to go and train in Amsterdam. That's what gave me that opportunity, because I don't think the hospital would have done that for anybody. Hospital that cannot even afford to pay for your what do you call it, for your updates, that will wait for years to pay for updates. How would they think of sending anybody abroad to go and train? So joining all these international professional organizations will also give you some leads. And lastly, on the prospect is the area of artificial intelligence. Artificial intelligence has come to stay in the field of laboratory medicine. Every aspect of pathology is now being, taken over by AI. An era is coming that even in histopathology, you may not need to look at slides again. AI will be the one to do everything for you. But we need to step up our games to be able to catch up with the trend of time. Well, what more can I say? I only say that the sky is the starting point for everybody that wants to fly. And as far as the field of laboratory medicine is concerned, it's still rapidly evolving. So on this point, I want to say a very big thank you for the opportunity to say one or two things about the career prospects and opportunities in laboratory medicine. Thank you and God bless. I'll be waiting for your response and questions. Thank you.
Thank you very much, sir. We are very grateful. Thank you for that illuminating section. He has exposed us to all the uncharted area in laboratory medicine, and the call is that the world and Nigeria, in particular, is still in need for people who will take up opportunities. So, our dear listeners, you can drop your questions in the chat room, in the chat section. Take them after we second speakers. Take the second speaker. We'll proceed now to have the second speaker, who is in person of Dr. Dolapo Magiola. He also has his residency training here at African University Hospital in Ife, and is a fellow of the West African College of Physicians and consultant hematologist in OAUTHC in Ife here. As was stressed earlier in the first lecture, he has special interest in hemato-oncology and is a member of several international advocacy organizations. Join me to welcome Dr. Omoyola for the second section of you are welcome, sir. Thank you, sir.
Thank you so much. Good afternoon, everybody. I want to thank the president of the OAUTHC to share some of my thoughts on the topic called career prospects. I want to thank Dr. One of many ways, it has helped us. I think what I'll just do is try and put some apology terms So thank you so much. So without much ado, I'll just start on by saying that, can you all see my slide, please?
Yes.
Oh, okay.
Yes, please, you can put it on slideshow. It will be better on slideshow.
Right? Slideshow,
Yes.
okay, you guys can see almost everything there. Okay, thank you. Is this better?
Better, sir, thank you.
Okay, thank you so much. So I'll be talking on career prospects in hematology. I have no disclosures. This is a slide showing the faculty members of the Department of Hematology. Extreme left there is biology, cell. Some of the people I've talked about actually trained teachers. Some of the things I'll be sharing with you are some of the things that not only them, also my results. So actually, what is the need? You know, is there really need? Is there a need really for oncologists or oncologists? Excuse me. You know, in today's world. So by way of introduction, I'll just be spicing things up by sharing some slides, just some data with us to, you know, trigger our thoughts along some of these lines for some people who are already hematologists and those who are aspiring to be one, to be, you know, oncologists. The global burden of cancer is real and currently on the rise, with a global incidence of 19 million cases, almost 10 million cancer deaths. Cancer ranks as the leading cause of death compared to increasing life expectancy. This slide was, I got it from GlobalCon data, and it's one of the most recent data showing the incidence rates and mortality rates of all the continents, you know, as regards cancer in the whole world. And as you can see from the slide, it's quite evident that the mortality rate from cancer is way higher than the incidence rate from cancer in both Africa and Asia. Don't forget that Asia and Africa, they form a huge proportion of the population. Excuse me. So this slide also was, I also got it from the Global Climate data, and it shows, you know, 4 categories of, you know, countries classified as low, medium, high, or very high human development index countries. And as you can see on the extreme left, the low human development countries who fall under this category. Of course, Nigeria falls under this. In the next 20 years, it's been estimated that the burden of cancer will rise by 96% in countries that have low human development as compared to countries with very high development index, where in the next 20 years, the rate of increase in the burden of cancer in those regions will be like 32%. So what could be responsible for this huge, you know, disparity between the burden of cancer in developing countries, you know, and when compared with industrialized countries? And this is a paper that was written by Canvas on the rising burden of cancer in the developing world. And, you know, from little he was able to report, he found that there were 3 cardinal reasons why the burden of cancer in the developing countries is way, way, way exponential, you know, when compared to wars in the industrial world. Infection is responsible for nearly 25% of cancers in developing countries as compared with, you know, 10% of cancers in developed countries. So in that same paper, he was able to point out 5 major infections, you know, that have been indicated for causing this huge cancer burden in developing countries. 90% of global cases and deaths, are from cervical cancer, actually in low medium income countries. Of course, we all know the role of plays in 80% of global cellular carcinoma actually in the whole world are actually present. 74% of all H. pylori infections are common in LMICs as against, high income countries. Of course, HIV is a global infection, but, in developing countries, there are 500-fold higher, incidence of sarcoma, when compared to high income countries. So major national policies, also was reported in this paper. I'm bringing this home to, where we live here in Nigeria. We find also something very similar, like lack of adequate coverage. A country of 216 million people with just 40,000 medical doctors as reported. Less than 150 fully trained oncologists. The ratio of doctor to population in this country last count was 1 to 5,000. It's against the 1 to 600. Of course, another factor playing a huge role here is affordable care, poor health insurance coverage. And there was a paper that was published in 2022 now said by the budget reported that only 3% of the whole population in Nigeria actually have health insurance coverage. And of course, due to the fact that we have lack of functional cancer screening programs, the burden of cancer is, definitely going to be rising. So this is just a slide showing the most common cancers, of course, female breast cancer is tops the list. In Nigeria, female breast cancer is still tops the list, but at the fifth, item there on the list is non-Hodgkin's from data. So it is worthy to note that the above data, that was published from GlobalCan was gotten from just 4 cancer registries in Nigeria. Instead of ever, Nigeria has 26 cancer. So what that means is, the remaining 22 registries actually, the data from those registries actually never made it to the GlobalCan 2020. So hence the burden of cancer in Nigeria is not fully, this is mostly due to lack of statistics or reports. Makes age-specific incidence rates possible and inaccurate. Large proportion of the population still never seek orthodox medical care, and so therefore these cases issues are lost. And we've seen the role that national policy plays. How we don't have enough pathologists. We definitely do not have enough histopathologists to consider what Dr. Tifik told us earlier. Neuropathology and field is a very veteran one for those who want to consider the career prospect in that area. But looking at the other side, what is actually also the attitude of people really towards the healthcare system. And so I wrote this paper. This paper was published and it was published in this paper. And he looked at the prevalence, the determinants, knowledge about herbal medicine and non-hospital status. And it was a cross-section study. Looked at over 1,500 respondents in Ekiti State. Of course, Ekiti State is one of the most states here. There's a saying almost every house has a professor. And as you can see from the data before us, that they, divided the respondents into 3 different, groups: low income class group, middle income class group, high income class group. And they looked at the frequency of, herbal home visitation within the last 2 years on the point when they were, having these consultations. That, more than 50% of the whole population actually had visited herbal homes, 1 out of 10 times, And looking at the cohorts of these patients, they found that, the reason for herbal, medicine use was simply because majority of them felt that, it was very effective. And this actually cut across all the income classes, both the low, including the low, middle, and high income class. So, of course, this data just shows us that, just further buttressing the point, that there's actually a need here for awareness. Most of the people who responded were, between the ages of 30 to 39. Most of the people who responded, to this study had tertiary education. So this was not really an issue of and most of them are actually civil servants. And many of the civil servants, of course, probably self-employed. And like we said earlier, many of them, the honest reason was because they felt that herbal medicine was, very effective. So although the respondents, they knew the difference between certified and uncertified herbal medicine and possible consequences, you'll have thought that certified herbal medicine use will have been more common, but that wasn't the case. Uncertified herbal medicines were actually more commonly used, and this is not peculiar to Nigeria. This is also common. So we see a need here, for improved healthcare awareness and consequences. What's the implication of this data? The implication, of course, is inaccurate decision making, planning, implementation, cancer control measures. Why should the federal government, have employment possibilities for just 50 people when they should be thinking of 100 people, 200 people to match the need, out there? Inability to accurately assess the cancer burden within the region, and missed opportunities of nationwide research. So, of course, I'm sure you know Brian Drucker. I'm sure every hematologist knows him. This was the man who was instrumental in discovering the hematology. At the time, he was a fellow in the Farber Institute. He was working with on CML, and his discovery actually was the first discovery that showed that they could actually, that precision medicine was actually possible. It takes us, to the area of molecular pathology. This is so. Of course, Gleevec was approved in 2001, but 10 years earlier, the gentleman had died of CML. He couldn't get the stem cell transplantation, and his mother named the foundation. And his name was Max. 17 years old. Sugar Foundation and Foundation they've been able to make TPIs to third world countries, like South America, Africa. This paper was published by our faculty chronic myeloleukemia is anemia, independent predictor of disease. And looking at the data, you can see that there were 3 groups of patients that were looked at: patients who had chronic phase without anemia, chronic phase with anemia, group B, and then those who were not in chronic phases and also had anemia. You can see that the overall survival over 10 years was really bleak. It was terrible for the group C people. And the median age group here was 37 years. Prior to the discovery of, imatinib, before the era of precision medicine, the overall survival in our center for CML patients was not, remarkable. It wasn't more than 18 months. Era of cyclophosphamide, RRC, so, but looking at this study over 10 years, where more than 80% overall survival for all the patients were seen. Only 27 patients over 10 years, 80% of them were still alive. So that's pretty remarkable. So the Argo actually, which of course, this was something Dr. Adefi was talking about. He was talking about Argo to focus on it and later on in his presentation. So Argo was started by Professor Action and Dr. Kingham, and they have a very strong presence in OAUTHC. And one of the things they were able to do was establish a special registry here in OAUTHC, and they're collecting data on colorectal cancer for a while now. And then they ran a study. So this is the world of solid tumors, oncology. So they did, what they wanted to do was they wanted to look at the molecular profiling of colorectal cancer patients in West Africa, and they compare some of these results, with what, had been done in, MSK. And they found that majority of our colorectal cancer patients who present, at late stage, because we're not surprised, we have a strong screening cancer program for colorectal cancer. 53.8% of them will present stage 4 as against 36.2% of them. MSI high is it's a form of colorectal cancer that where mismatch repair enzymes are activated, and we found that the most 28% or most of the colorectal cancer is actually MSI high. This was huge compared to what other data and what they also had. So this is just a data. I think the only thing I'll just say here is about the fact that when they looked at those who had MSI high, they looked at BRAF mutation and found that none of them had BRAF mutation, showing that majority, if not all, of the 28% patients probably had. This has a therapeutic input because the use of Pembro will be useful in some of these patients. So it is not exaggerating to say that never in the history of medical science, have we had such opportunities like this for advancement in the fields of hematology and oncology to be as great. The sequencing of human genome has facilitated the identification and subsequent characterization of disease-specific and disease-related genes. These advances, they've led to an improved understanding on the genetic basis of cancer, its position and molecular. What is hematology? I get patients asking every now and then hematology. So hematology is the study of blood and blood-related diseases. The field of hematology can be largely divided into the oncology aspect of it. I just talk us about you have the benign aspect of it. And outside this country, the specialization is so subspecialized that one can find specialists who just deal with benign. Have other specialists who just deal with in-home. Just deal with only the oncology aspect. Here. So I think one of the reasons for some of the things, the experience we are having in our clinical practice, to even start with, we are not enough. We don't even have enough doctors. I want to talk of enough hematologists or oncologists or this to start with. So in the area of hem-onc, we talk about all the solid tumors that originate from lymph nodes or from the blood cells. So this would be lymphoma, myeloma, yes. There are tons of these plastics. In Nigeria, as Dr. said earlier, all use treatments. The postgraduate training program. And benign hematology would involve, anemias and hemoglobinopathies, population disorders, bone marrow transplantation, blood transfusion. And like I said earlier, outside this country, people are so specialized that, you find doctors just working in bone marrow transplantation centers. That's what they do. morning, afternoon, night for the rest of their life. You know, we find cases of people just involved in blood transfusion centers. There are, you know, job opportunities in the Arab world, where, particularly in Saudi, in Qatar, where find hematologists leaving Nigeria, you know, to work in blood transfusion centers. And because the level of training there is very good, you know, if working in blood transfusion labs, yeah, with the little knowledge, experience, skill. Most times when people get out there, they need them directors of the blood transfusions. We've seen like one or two cases. Some of our people are not. So oncology is the study of, you know, solid tumors. The solid tumors, apparently, not the study, but, you know, okay, yeah, it's a study of, you know, cancer. And there are three arms of oncology generally. You have medical oncology, radiation, surgical oncology. Medical oncology is a branch of medicine, focuses on treatment, using therapy, therapy, immune therapy to treat cancers. Radiation oncology is used for radiation therapy. Surgical oncology is, you know, just to. So talking about choosing a career path, yes. How many paths are there? What is your destiny? What exactly you want to achieve? Only different people. I mean, how affiliated what do you really? You know, I think these are the questions you need to ask yourself. I know that.
Oh Lord
Hello?
Almighty, may your hand rest upon them for good. I ask for your provision. I ask for God.
Hello? Can you hear me?
Yes, sir. We can hear, but the line is breaking. I don't know if you can switch off the video so that the bandwidth can be improved. We can hear you, sir, but the line is breaking.
Okay, there's nothing at my end. There's nothing on at my end. I'm sorry. I heard somebody speak. So there are different pathways, and you know, for people who want to achieve or who want to attain a diploma or a master's, the minimum requirement in Nigeria, you know, is you have an undergraduate. I mean, you have your certificate. You want to undergraduate, graduate. You go to NYSC and then you can apply for diploma or master's. There are very few institutions. I think the University of Calabar, I think they offer a diploma. Maybe still do that. And ABUs degree masters. So the conventional pathway, which I think most people on this call are on, right, is the pathway where doctorate requires some requirements would be to have gone to school, and then possibly you have, you know, on your internship and NYC rotation, and then you then have to, you know, start a residency program afterwards. I'll be like the pathway to a clinician, like. And so we live in an era now where, you know, so many things are changing very quickly, you know. And, you know, usually there's a standard career path of, you know, being in clinical practice, either in the hospital that is attached to academic institution like OAUTHC and OAU. You can be a oncologist after your training, and maybe you're working with same lab, or you're working with a private, you know, lab out there, you know, as a hematologist. These are also possible pathways you may want to explore the clinical practice to work as hematologists, where they are not in typical academic institution setting like OAUTHC or maybe use area, but probably maybe Laguna Hospital, for example, private set. And, you know, no matter where you find yourself, whether you are in the academic setting or you're in a private practice, there are always opportunities for research to see patients. You see patients, you have clinical practice. And there's always room for you to be able to, engage in educational forums and, what have you. So I think I already talked about this. So I think we talked about this already also. Entry into a residency program here, I think everybody knows this. Yeah. There's no residency training in medical oncology. However, the field medical oncology is, if you're an MO or house officer, and these are people who are also members of ARD. If you're interested in doing residency in hematology, there are 2 colleges in Nigeria that offers this, a West African College of Nigeria. So, why be a hematologist? Is it really highly rewarding? You're looking at career prospects. Why should you be? Like, what are the pros and cons? Does it give you extra time? The work-life balance, is it better than, being a surgeon or being something else? Is it highly rewarding? So I think these are the questions you need to ask, before you set out, to build, a career, in oncology. And unlike in other parts of the world where, what they pay the hematologists is the average amount of money that the surgeon gets. In Nigeria, there's usually just a blanket pay for everybody. Is it a dynamic career path? Is it something you can easily get bored doing again and again? Does it have the prospect of evolving over time? So I think my response to that would be that there is no branch of medicine in the last at least 10 years that has evolved as fast as the field of hematology and oncology. And this is because we live in an era of molecular medicine where, like Dr. Philippe said, almost everything we're interested in right now is, how do we treat patients? How do we, treat this patient by just addressing the cancer or the disease without affecting them ourselves? So it's really an interesting field, that you should think about. If you are interested in, being involved in something dynamic, something always change. However, your environment will limit you depending on where you find yourself. If things are really evolving fast and you love that kind of speed and trend, you may want to be in that kind of environment and not, being in an environment where things it's stagnant and not really moving. But definitely hematology is a very dynamic field. And is it a specialty in high demand? Like I told you earlier, they're just less than hematologists in the country. And, there's always a need. And so, sometimes I find people trying to make choices like, okay, which residency training should I choose? One G is saturated. You have like 100 people applying, like, okay, yeah, I don't really care anything I want, So is it really a specialty in high demand? I'll say yes, of course, the Japa syndrome has affected some knowledge. Definitely. Does it provide opportunity for strong support? These are the kind of career prospects we want to look at. Like, are there, opportunities for award scholarships, research funding, mentorship, education and training programs, international collaborations? The answer is yes. But the key to, answering these questions, how do you assess award scholarship? Dr. David gave us a beautiful example, of how he had to join, society, and then down the road, it paid off. It's something that's even unfortunate. So the role of oncologists, hematologists, I'm assuming we have AMOs on call, and just to give you an you're thinking about doing hematology, we recommend tests to determine whether a person has cancer. One of all of these also. Talking about treatment options, try to tell patients available treatment options. Those options not readily available in the environment. We explain the diagnosis, and we try to stage and type their cancer. We help patients manage the symptoms and side effects of cancer. So if you're thinking about, having area prospects in oncology, I think we would have to seriously consider the role of mentorship. It's not only in hematology. Mentorship is the cornerstone for building a very strong the terms of mentorship as a choice. And that's why I put up this slide. Effective networking and mentoring are critical determinants of success. In hematology, but not only in hematology, and then due to the lack of protected, this is what Dr. Rifi was. We do not have a protected time. We may not, don't let me say we, or we may not have, depending on where we work, where we are, we may not have a protected time for research. What does that mean? That means that time is set out for just research, or nothing should touch that time. No clinical work, no nothing, just protected for research. So due to the lack of this, kind of setup, the cultural mentorship has not fully been nurtured most academic. And so recognizing, critical contributions of mentors, could be the cornerstone of, implementing such a framework. And mentoring is a remarkable opportunity for professionals in that area. It can enhance, job satisfaction and can be a breeding ground for collaborative projects. So what exactly is it? It's actually a relationship between a more experienced and knowledgeable person and less experienced person too. And it should be symbiotic mutual and beneficial to both the and the mentor. The goal really should foster both personal and professional growth of the involved participants. And mentoring is a dynamic relationship centers on career development and also the mentees research output. So, before you can, develop a program where you have a mentor and you guys have a relationship, one of the first things you need to do is to identify, the potential needs and your main goals. What exactly do you need? Do you need a mentor for? You need a mentor for research grants. Do you need, mentor for? So you need to identify, exactly do you need a mentor for? And then when you design such a plan, you should, anticipation is key, right? Mentor, mentee pairing, very important. You want to, be a mentee to someone that you guys have a working relationship. You guys are friends. You guys are confidence. And when there are cases of conflicts, monitoring and guidance is very important so that there's no strain, that delicate relationship. So I put this slide up just to show us, highlighting on the extreme left, mentee's potential needs. What exactly is the need of a mentee? Is the mentee looking for fellowship opportunities? Is the mentee looking for grant opportunities? What exactly does a mentee need? That he needs job opportunities. These are some of the things, that, you need to identify before you start, this relationship. And on the extreme right, you can see that, there are tremendous opportunities here, potential opportunities that can meet some of these needs. Like the mentor introducing the mentee to clinical research work or the immunology study. Dave Philippe was advising that, always start small. We not been involved in any major research. Do volunteering work in just data collection. Never can tell whether we'll get nice data. So, these are some of the things and some of the ways to meet some of these using education programs, getting involved with your mentor research. This will open up doors, to special grants. Finding a job after residency. I don't know if you guys need this slide, but I just put it up there, because I don't know. But if you're looking for a job after residency, anywhere in the world, really, I mean, you should consider this. And I think it's just basic stuff. And how do you look for job opportunities? Check newspapers, national journals, personal contacts. If you know someone and knows someone who knows there's a job opportunity somewhere. So, of course, the general success criteria for getting a job as an oncologist, demonstrate a positive, professional image, demonstrate excellent interpersonal skills. Of course, once you finish your residency, naturally. So the training here, is it different elsewhere? Like, looking at, the career paths, is it different elsewhere? Living here, at what cost do you like something similar, or is there something, different out there? So in the United States, the way our program is structured such that, after your residence, so usually the pathway is usually divided into two. And the beginning is the early part is called residence. After part is once you're doing it. So after everybody has to do right. So once you finish residence, then begin to see, what specialty do you want? Very interested in all your oncology system structure. It can be offered both at the same time. So you can have in both hematology, or if you just want to stick to hematology, just go for the board exams all day long. And if you just want to stick to oncology, you just go for the board exams. Of course, the time frame for preparation will be fast. And if you're going for both, it's not going to be less than. But if you're going for either one, you just need 2 years, to be board certified. Board certified. Yeah, so Dr. Alex also talked about this, and I'll just touch on it, very briefly. So, I mean, there are more professional, societies than like OAUTHC, AACR. I just put this here as well by itemizing one or two societies. We have the Nigerian Society, the College of Blood Transfusion, American Society of Clinical Oncology, Society of Oncology, Society of Oncology. But the question is, why should you join? Why should you be in some of these groups of patients? Like, I give you the leverage to be able to subscribe to their journal at a cost. So the cost might, you might not really feel it. It must be very, very convenient and affordable. So you may have the opportunity to do that. And the opportunity for career development and networking also increases, because sometimes when you're applying for grants and you're applying for an opportunity and they see your CV, you're like, oh, okay, you're one of us, you're one of our members, it speaks, about your interest in their own. So it gives the picture that you guys share core values and share professional interest also. So opportunities for career development and networking is key. A web-based reading list of key articles of interest to trainees. So every now and then you can find some of these societies sending you key journals. Maybe there was a breakthrough discovery that was published in that journal, because most of all these, if not all of them actually, have their own journals where they publish their own research work. And so if you are a member, you know, they may send you complimentary copies, articles. Somebody just did something and wow, they wanted to hear about it. And also you can have opportunities of assessing educational programs targeted at subspecialty trainees at national meetings, you know. So they tell you that, okay, ASCO is going to be having plenary session, maybe June, we'll be taking abstracts, you know, from so-so time to so-so time, you know, so submit your abstract before so-so deadline. Gives you the opportunity to be able to put, you know, your own little work in your own domain out there. So it's something you can work with, you know. So you begin to think about, you know, going to that conference, you know, meeting more people. Well, if you don't join that organization and they don't have your email, there's no way they're going to keep you updated on the activities. And when you get updated on those activities, it creates, you know, an opportunity for you to meet more people, make more connections, and make things happen. Special grant programs also are usually very available. And then, you know, most of all these opportunities would be renewed. So I just wanted to touch very briefly on the Sudava fellowship and, you know, like everything in this slide. Not this Sudava Memorial Fellowship was established in New York Community Trust. Done and transit Sudava as a memorial to the school. So it's a very lovely. And, you know, we created this fund for Sudava fellowships. So it's a fellowship that, you know, so if you've passed a part 2 year on this call, it's something you should be looking at. You should be looking at applying for this kind of fellowship, because the requirement is, you know, you have to have passed, you know, your finished residence. And it's a fellowship that gives you the opportunity to travel to New York for 3 months, and your paid stipends of $5,000 every month. This is the schedule for the application, and that is the link for you to apply. So these are different organizations with the links below available if you're interested in applying for fellowship grants. Apply for fellowship grants and grants, fellowship opportunities are here. Some are for 2 years, some are for maybe 6 months, depending on the institution. Some of these grants allow you to stay over there, feeding house, because I was below there, I did Argo pilot grant. So the Argo, sorry, I'm talking more about Argo because it's closer to us, and you know, this is an opportunity for everyone to, like, you know, take advantage of. You know, Argo provides cancer research units. So some of these, depending on, you know, the requirements, you know, for the fellowship, you know, there's some of these fellowship grants that, you know, you don't need to have finished your residency program to apply. You just apply, you know. Once get such requirement, then you finish your residence and then you apply. Still an opportunity. You know, there are tons of names. I can't reach it. It's just so many. So for the Argo, we provide council research training to junior faculty members at Argo sites. And so the link is there below. And the opportunity includes who are attending in person, virtual training courses, the ability to apply for annual Argo pilot grants. In addition, several Argo academic members were selected to chair for Harvard Principal practice of technical research training course. So in conclusion, recent events, makes this an excellent time to pursue the fields of targeted therapy and opportunities for progress in this. The development of targeted therapy opportunities for progress in these disciplines have never been greater. However, career development should be an active process, strong collaborations with the third groups.
Thank you, sir. Thank you very much, sir. I really appreciate the enlightening lecture on career prospects in hematology. Particularly, I appreciate that you really answered the questions that goes on in the mind of we young doctors. Is it rewarding? Is it dynamic? How is the training different from other parts of the course? And I particularly appreciate you exposing us to the opportunities, the fellowship, the various organizations that are even close to us, that many of us are not aware about, especially that Africa Research Consortium on Oncology. Thank you very much, sir, for taking time for this schedule to give us this presentation this afternoon. So now, our beautiful participants, we can have questions from us. If you want to ask your question, just click on the raise hand icon. Soon up, just drop a question chat button. We already have a question which was directed to, I think, it was directed to person is asking that is concerned about the enormous rate of brain drain in Nigeria. Is asking that among all the career prospects, that which one will make a pathologist or that decides to stay back in Nigeria to be well fulfilled and to be self-sufficient. So which of these career prospects is suitable for someone that wants to stay in Nigeria and like to be I want to get future. There are no other questions for now, so I don't know if you would like to take the answer.
Thank you so much, Dr. Omoyola, for that wonderful lecture. I really gained a lot, even as a person. Well, in response to the question that was asked as to what areas of pathology, what aspects should one venture into that will make one to be comfortable in Nigeria, considering the scourge of brain drain that's bedeviling Nigeria right now? Well, I'll give a general response to that question. Number one, I think one important question you need to answer as an individual is, am I staying back in Nigeria or am I traveling abroad, just like many people are doing? And if I'm going to travel abroad, what exactly am I going to do there? And if I'm staying at home, what am I going to do in my life? Those are questions that you need to answer as an individual. There's no one size fits all, because if you ask me, should you travel abroad or not? I will tell you, what do you want? I mean, the fact that everybody is traveling abroad does not mean that if you travel, that it will work for you. And believe you me, everything is not just about money. If you travel to the UK today and you start collecting, is it 3,500 pounds or 4,000 pounds now you are collecting? By the time you collect it for 1 or 2 years and you look at the bills that you have to sort, sometimes if you tell yourself the truth, you like to ask yourself a pertinent question. have I taken the right decision? It's not just about going there to do a most job and making money. After 3 or 4 years, will you be happy with yourself? Will you be happy by the kind of professional progress that you have made? So I think as far as aspect of pathology is concerned, if you are staying back in Nigeria or you are traveling abroad, the number one thing is you need to identify your area of interest. Which area of pathology actually interests you? Believe you me, there's no aspect of pathology that cannot bring you money, if that's what you are concerned about. There is no area of pathology that cannot give you money. But like you say, it's a career, something that you have to build. It's not something that you do in 1 year and you want to make millions of dollars. You need to take time to build it. So my own succinct response to that would be identify your area of interest, then try to find out the opportunities that there are in that aspect so that you can develop yourself. By the time you develop yourself to a point, you eventually become a focal point that people will be bringing all their problems to. And when you solve problems, that's how wealth is created. It's not just by doing what every other person is doing. If you have to do what every other person is doing, then there's nothing special about it.
So, Eric, we are asking questions. So, I would want to.
Okay, thank you very much for this great opportunity and this lecture. I think it's quite interesting, and truthfully, career pathway in laboratory medicine is an interesting thing, and everybody wants to know how to develop its pathway. Currently, I'm a resident in pathology, in UPTH, in anatomical pathology to be precise. And my question is, now, as a resident in anatomical pathology or as a pathologist, having finished the program or still in the program, how possible or how feasible it is for one to have a career pathway, probably in the FRC part, to get a placement there to continue the program, or how possible it is for one to be identified in that, to get the fellow Royal College of Pathologists, probably in the UK or elsewhere. Thank you, sir.
Hello?
We can hear you, sir. Probably
okay,
just
so I think I'll be able to talk about for hematology, because I think it's for some fields outside, they usually would differ. So if you want to become a fellow at Royal College for pathology, you would have to do MRCP. And for MRCP, I think it's something similar also for histopathology, if I'm not mistaken. I don't think it's MRCP they do. I think it's a different exam. Because for hematology in the UK, hematology and internal medicine, they're very closely associated. So, but for histopathology, I don't think it has any affiliation. So, but for hematology, you would need to do MRCP 1 and 2. And after passing MRCP 1 and 2, you then need to do PACES. After doing PACES, then you would then qualify to be a member of the Royal College. At that point, you then have to apply to go for training, like, would I call it training? Yeah, sort of, maybe like some form of, you'll be practicing, but also you'll be practicing as a member of the Royal College. And then within a stipulated period of time, maybe 3 to 4 years, you can then write the fellowship exam and bag fellow of the Royal College. So I think one of the good things now happening about that, and MRCP exam, you can actually write them in Nigeria. I think there has been recent review to that effect now. MRCP 1, if I'm not mistaken, MRCP 1 and MRCP 2 in I think Lagos. So you don't need to travel to Dubai, you don't need to travel to Ghana. you need to travel to the UK or to Australia to write those exams. And the UK, they are not bringing the exams to us, So those exams can be written in Lagos, and you can take out your time to write these exams. And once you pass the exams, you write cases. And once you pass that exam, then you apply for fellowship and train on the writing exam. For histopathology, I think there's a different exam they write. I don't think it's MRC. I don't know if Dr. Ali Philippe can talk on that, can touch on that.
Okay, yes, I think he's back on you. So maybe I'll recap the question. Or again. He had posed the question, trying to find out the feasibility of the rest. Yeah, he had asked the question regarding the possibility of a resident in Nigeria, probably as a resident or a fellow, attempting to get membership of the Royal College and possible routes. Dr. Moyela had already tried to explain pathology. We had hoped you could shed some light for anatomic pathology. Dr. Professor.
Hello. You need to unmute. Yeah. Okay.
Yes. Okay.
Sorry, I lost you at the point.
All right. Okay. That's.
I
can recap the question. Yes. Yeah, I can recap the question. All right. Yes.
Please do.
So, Dr. Fukumo is a anatomic pathology resident in Southwest Nigeria, UCH, and he sought to know the routes to get membership or fellowship of the Royal College of Pathology. If it was possible as a resident, or you have to wait till it's done with residency. For anatomic pathology.
Okay. Hello?
Yes, sir.
Hello?
I said yes, sir. The question was on the routes to gaining membership and fellowship of the Royal College of Pathology, specialty in anatomic pathology for residents or prospective fellows in Nigeria.
Yes, sir. Okay. Well, there are many routes. I will just talk about the common ones. Number one is, as a pathologist in Nigeria, starting from senior residency to post-part 2, as a senior resident, you could go through the PLAB part. If you write PLAB, of course, after your PLAB 2, you can apply for job in the United Kingdom. And when you're going to apply for job, you apply for specialty position in pathology. There are hospitals in the US with pathology laboratory where they take you in as a special, as a special registrar in their own hospital through the PLAB route. And of course, you practice there for about a year or two, and they observe you. Then you can be signed to write their membership exam. That's MC parts, membership of the Royal College, to write their exam. So if you pass the MC parts, of course, that may be your route to going to prepare for FMC parts now. I mean, what do you call it now? FMC fellow of the Royal College, FRC parts. Now, that's number one. Number two is that you can actually write membership of the Royal College of Pathology exam from Nigeria. Even as a senior resident, you can apply for that exam. And even post-part 2, you can apply for that exam. But I must tell you that it's an exam that will require all fiber of you to pass, because the standard of the exam is high, but I believe you can pass that as a Nigerian. If Nigerians can pass USMLE, I mean, I don't think there's any big deal in passing membership of the Royal College of Pathology exam. So those are routes that you can go through, but the easiest, I must tell you, is to actually write it from Nigeria. It's more difficult. I mean, the exam is difficult, but if you have to go through the PLAB route, it will take you about 3 or 4 years before you get into the program fully. And you know, even in the UK, getting into histopathology training, it's very difficult. Those are one of the regulated areas, you know, unlike GP. I know so many of my senior colleagues who finished here and went to the UK. When they got to a point that they realized that they couldn't continue to practice pathology, they had to go into residency in GP. And you know, somebody who has acquired so much skill in pathology, and because of the fact that she could not continue, she had to go to GP. You know, that's somehow. But you know, if you know you are poised to want to continue in histopath, I will advise that you make attempts to write the MRC part exam from Nigeria. That will be my response for now. I don't know if you have been able to answer the question in a way. Thank you.
Thank you very much, sir, for that. Dr. Bukumo, I don't know if you still have other clarifications.
Yes, well, just answer the questions. Thank you very much.
All right, that's great. That's great. Okay, well, I have one of my own, but before that, I want to take this from Dr. T in the chat. He seeks to know the career path in private practice and laboratory medicine, and also the ideal practice on laboratory accreditation in Nigeria. And okay, I think I'll just take it in items. So the first one is he wants some more info on career path in private practice in lab medicine. That's number one. Number two is on ideal practice of laboratory accreditation in Nigeria. And the last one, okay, still a subset of question 2. He wants to know if a doctor, not necessarily a pathologist, maybe a medical officer, for example, can own a lab, and who is responsible for accreditation? So I think any of our chiefs can provide some response to that. The career paths on private practice in lab medicine, and then if a doctor, not necessarily a pathologist, can own a lab, and whose responsibility it is to accredit laboratories in Nigeria.
Okay, just a quick one. As far as the career prospects in private practice in Nigeria is concerned, is one very lucrative area that many of our colleagues have not looked into. And it's unfortunate that the people who are in the business today are mostly non-Nigerians, and they are really cashing in on Nigerians in a big way. I'm so sure many of us are aware of Mikio Laboratory in Lagos, Mikio Diagnostics. You know, they provide a lot of laboratory services at very high cost. And Nigerians are, you know, we don't have a choice. People are patronizing them at a very high rate. For instance, when I got back to the country, I tried to initiate immunofluorescence services in Ife. And it dawned on me that before I came, there was only one lab who was offering IF in Nigeria, and that center was in Kano. And as at the time I got back, even that center was almost folding up. started, we said, oh, you won't be able to pay, but we started it. At another time, we increased the price to 35,000. People kept paying. As I speak to you, it's now 50,000, and people are still paying. And it's because it's government owned. But I'm telling you, if we take it to 100 today, people will still have no choice other than to do it, because our center is probably the only center in Nigeria currently offering that service, apart from private laboratories. And private laboratories, obviously, will charge more than that, even though they won't do it in Nigeria. They will only collect the sample and send it to US. So what I'm trying to say is, private practice in laboratory medicine is very lucrative in Nigeria. All you have to do is identify those tests that are being ordered in the hospital that our center cannot provide, or even the ones they can provide that the results are not returned on time. So you just look at that. Of course, you need a lot of money to be able to put up a very good lab. You need a lot of money. And I think at this point, all of us should begin to think about how to collaborate, financial wise, because many of our other people, the non-medics, the laboratory scientists, they are the one running most of the private labs in town now. Don't even know what they are doing, but their Chinese results are being used by our colleagues. So what is missing, and should be ready. It's still the Medical and Dental Council of Nigeria, So they will be the one to still accredit the lab, because they accredit virtually all the hospital facilities in Nigeria. So they are still the one that will accredit your lab. And I tell you, it's not as difficult as you may think it is, particularly if you are a doctor, because the council is actually looking forward to many of our colleagues now, so that we can bridge the gap, because what we currently have is not the best that we can have. Thank you.
Yeah, thank you, sir, for that
Hello?
clarification. Yes, I can hear you. Say thank you, sir, for that response. I think you addressed all the questions that were asked. Okay, mine is, well, for both of you, really. One has to do with membership of international society. Yes, while it's recommended, in fact, I personally tried to go and register for some, but the issue is this issue of cost. I think probably at the time when you registered, the exchange rate was not as unfavorable as it is now. So I don't know. Are there possibly, let's say, waivers, or I don't know, or maybe like special memberships for those who are middle income countries? And then the second question is for Dr. Moyola. He mentioned something about mentorship. Well, there's also something we also try to go around. Sometimes you want someone to mentor you, but we also don't know where to draw the line, because some of the mentors tend to now convert the mentees to PAs. You see them going here, you go. In fact, also it was so funny. I went to mechanic once and I saw a guy with consultant person. I was like, my mentor. And I was like, so I don't know. How would you advise that prospective mentees also draw the line between the true mentorship and then just being, I don't know, say around boys? How would they? I know it's how would they, be able to distinguish? If they can shed some light on this, so these junior doctors can know when to say yes to some things and when to say no, or maybe just something that like the responsibility of a mentee to a mentor and a mentor to a mentee. I mean, thank you, sir.
Yeah, thank you so much, Dr. Onufo. I think you asked a very important question. The thing is, like you rightly said, our practice is actually colored by, our background, environment, where we find ourselves. Many times, care is not taken, like you said. Mentoring program not really about it. There are different ways actually. So sometimes there have been cases where these are known facts where a mentor would choose a mentee. That's one. Two, there have been cases where a mentee would choose a mentor. And so I think in this kind of scenario for option number two, option number three would be an institution has a mentorship program in place. It could be a culture environment where constitutionally, once you come in, appeared attending would mentor you for a certain period of time. So other units would then rotate those residents as well. So for maybe the next 6 months, this is your mentor. Next other 6 months, this is and in that setting of an institution, that's like a culture or an established framework mentorship program. So like, one of the things the environment is, we don't have like a formal mentorship program put in place. Sure, many of us. So therefore, most of the other, mentorship program that we practice and we find ourselves in usually informal. Maybe you are the one trying to, lean forward towards this person. Usually that's the trend, right? Like the one maybe trying to. And so I would say that, if you're going to choose someone to be a prospective or a potential or eventual mentor, you have to sit down and ask what are the traits and qualities. Okay. And like I said in one of the slides, like sometimes there can be conflict. You don't want to strain that delicate relationship. That is where some form of guidance has to be inbuilt into that mention. And it has to be a two-way street. It takes a very mature.
Hello?
Yes. Can you hear me?
So you're audible. Yes, I think I'll distract you.
Oh, okay. So it can be very difficult, really, because of the kind of environment we may find ourselves. I feel like, there's really no straight answer. The key might be in choosing the right mentor. Sometimes you really do not know if that person is the right mentor until you start working with them, and then you begin to get the feelers that, oh, okay, maybe this is not the kind of mentor for you because there's some things you can't tell. So there's really no straightforward answer. Sometimes in the environment, because of the fact that you cannot really go that far without some form of mentorship. It's a price, you really have to pay. You have to look at, what are you willing to do so you can get this, and one may learn to tolerate people, for just that little time frame, and it comes for you to just. So I don't know if that helps. Hello.
Yes, sir. Yes, sir. We're here. I can hear you.
Okay. Yeah. So the first question about how does one become a member of all these international organizations, particularly the ones that are free or subsidized for colleagues from low, medium income countries like ours. I want to start by saying that many of them are actually free. Many of them are free, and they are easy to just join. For instance, Ago, Ago in Ife, You don't even need to apply for anything. All you have to do is talk to the people who are in charge and be attending their programs and identify with their visions. Professor Latishi Inife is the coordinator of AGO with Peter Kingham in MSKCC. And, Dr. Omoyola is one of the people that has been part of that organization. And I think we can tell you more about it. I'm also a member. I've also benefited from their developmental programs. So I think you can be a part of, if you want to be a member of AGO, just let me know. That's number one. Then International Society of Nephrology. When I joined as a resident, it was free. It was free. I didn't have to pay CC. All I had to do was talk to Professor Arundani, who is the focal person in NIFE. So I spoke with him. He was able to stand for me to apply for the membership online. And they took me in as a member. And that was how I was opportune to attend, to apply for many of their programs. So many organizations like that, OAUTHC, you can be part of. All you have to do is apply online. Some, you may have to pay some token. For instance, BDIEP, maybe every year you have to pay 10 or 20,000 naira for membership. But many are just free. So if you want to join any, just let me know. But it's determined by your area of interest. And that's what will determine whether you pay or you not pay, because their terms and conditions actually differ. But most of them are actually free. I don't know if I have been able to help with some information. Thank you.
Can I just touch on that briefly? Can I just add
please.
to what Dr. Adefripe did so well? And I just want to add to what he has said. There's some organizations, like he has said it all actually, many of all those organizations for LMICs, they would say, okay, they will have concession. Some of them actually will have like a different rate for people living in LMICs who want to be members. And some of them would say, okay, you know what, before you can join us, you need a letter from a current member. So you need someone who is currently a member now, so that if you want to join, the person can recommend you to the board. And then when you're now joining, regardless of the amount of money you're willing to pay, even if you have all the money you want, the member has rights, and I think that's why Dr. Philippe is also saying that if you're interested in joining any of all those organizations, because you might be a member of that organization, and one of the requirements may be that a current member has to write a letter for you to then get in. I don't know if you understand what I'm saying. So there are some ASCO right now. I remember the first time I actually applied for ASCO. I think the fee then was like $300. But now the ASCO fee now is free. You can be a member of the American Society of Clinical. That's interesting. So you can actually be a member. It's free right now. Before you needed like a letter from a current member to be a member of us. The OAUTHC is not free. I'm sure Dr. Adeshope will be anyway, it's not. That would mean you need to. But another good thing about OAUTHC is I think the fee for if you're not yet a consultant, I think the fee is less. Most of all those organizations too that are not free make concession for people who are in training, and they find a way to bring down the price and encourage people to
I think we lost. I think he lost network.
No, I think his microphone is mute. So I'm asking to unmute.
Okay.
Hello?
Okay, yes, I think. Yeah, we can hear you now.
Oh, you mean you couldn't hear me earlier? Hello? Hello?
We could hear you, sir. We got you up until we're talking about the $100 membership fee.
Yeah.
Something like
Yes, yes. So, like Dr. Arif said, just to add to it that some of those organizations, they actually have a reduced price for the ones that are not free for people who are currently in training for LMIC. So you might not really be paying way too much. But looking at the current, like you said, actually, looking at the current exchange rates. So that might actually be a reason. But in life you have to like grab low-hanging fruits, accessible stuff. And once you're a member, you just keep all the privileges. Thank you.
Thank you very much, sir, for those concise responses. I don't know if there are any other questions anybody wants to ask. It's been a wonderful time engaging with our chiefs. It's been worth the while. I also want to recognize some guests present from outside the Fed, President of ARD, Federal University, Federal of ARD, Dr. Eteke, as well as other guests and other leaders from other sectors. Dr. Igudalo from Orange, you can see him. Yeah, so I don't know if you have any other questions for our facilitators.
So we have a question that can we have professional society for medical microbiologists?
Okay, I think I answered that. I responded to that on the chat. I think there's American Society of Microbiology, European Society for Clinical Microbiology and Infectious Diseases. And they're also quite cheap. I think for ASM it's free. My egg meets about €7. So it's just like I said, the question is actually to encourage people that think maybe you need to pay some huge amount of money. And like our facilitators said, most of them are free, except for the very few that but even those that charge will give you some subsidy, some rebates if you are in training of students. That's all. All right. I guess there are no other questions. So in the absence of that, I'd like to especially what? Pharaoh.
Oh, thank you, my president, for standing. And want to appreciate our speakers tonight. I said in the introduction that they are always interested in making sure that we excel as junior doctors, and they've shown that tonight. Thank you for taking time out of your schedule to this exposition. This is virtually no aspect that was not touched. It's been an exhaustive discussion this evening, and I want to thank everyone that have made their time to attend to participate in the program. Those that have left, and some of us that we are still here, and members from our other bodies from ARD of other institutions that made it here this evening. Thank you for always joining us, and love spending the program. In the absence of any other thing, I want to thank us and hope to see us in the next edition, which will come up in April, when we'll be discussing another very interesting and informative topic. I want to say good evening and that we have a wonderful and give the